Good evening, everyone, and welcome to the school committee meeting of the Holliston Public Schools. It is September 9th. It's 7:06 p.m. I'm calling this meeting to order. Pursuant to Chapter 20 of the Acts of 2021, certain provisions of the open meeting law have been adjusted. The Holliston School Committee will be using remote participation and in person for this meeting. The audio of this meeting is being recorded and will be posted to the HCAP webpage within 24 hours in accordance with the governor's emergency action requirement of keeping the public informed of actions during this meeting. I ask that all participants remotely attending this meeting please state your name for identification purposes each time you speak throughout the meeting. At this time, a roll call attendance will be taken. Ms. Koshin?
Present.
Dr. Savard?
Present.
Ms. Bigelow?
Present.
Ms. Naborski?
Present.
Ms. Gupta?
Present.
Mrs. Raffi? Sorry, Ms. Raffi.
Present.
Mrs. Lesevnik? Present. At this time, I would entertain a motion to use hybrid/remote participation for this meeting.
Seconded by Stacy.
Moved by Dawn, seconded by Stacy. Roll call vote. Ms. Kotoshin?
Yes.
Dr. Savard?
Yes.
Ms. Bigelow?
Yes.
Ms. Naborski?
Yes.
Ms. Gupta?
Yes.
Ms. Raffi?
Yes.
Mrs. Lesevnik, yes. What's my next thing? Okay, so we're getting started. We are going to start with the minutes of the June 17th, 2021 regular session. Does anybody have any other further updates? I know Ms. Koshin actually already offered a few edits, as did myself, to Lisa Aronian. Does anybody else have any other? Nope. Okay, I would entertain a motion to approve the June 17th, 2021 regular session minutes as previously amended.
Moved by Stacy. Seconded by Dawn.
Moved by Stacy, seconded by Dawn. Roll call vote. Ms. Koshin?
Yes.
Dr. Savard?
Yes.
Ms. Bigelow?
Yes.
Ms. Naborski?
Yes.
Ms. Gupta?
Yes.
Ms. Raffi?
Yes.
Mrs. Lesevnik, yes. Oral communications. Does anyone have any individual comment this evening from the school committee? Stacy, go ahead.
So welcome back to everyone. And I hope everyone had a nice long holiday weekend, and, let's keep going here. We're supposed to have some nice weather this weekend. I just wanted to update the committee on the Comprehensive Long Range Planning Committee. Will hopefully have a meeting September 22nd. I'm still trying to work out some logistics and fees, some attendees. So I have nothing to report other than we're hoping to finally get together in September and to break out into sort of smaller groups to start actual work. So that's what's going on there. And
You do have a new name though, right?
well, so we want to rebrand it, because walking around saying, hi, I'm with the Comprehensive Long Range Planning Committee is
Mhm.
mouthful. So we are trying to rebrand ourselves as Envisioning Future Holliston. So we will be at Celebrate Holliston, which is a week from Saturday, the 18th on Central Street. So come and visit us. But also, I was going to mention that Celebrate Holliston is also an opportunity where you see a lot of our high school clubs and activities where they have, and sports teams have tables and booths. So come down and visit all your favorite Holliston hoops. It is on Central Street from 10 a.m. to 3 p.m.
So a different location than previous.
Yes.
Not everything.
And then not really a whole lot to report, but also I'm on the Traffic Advisory Committee, and we have been working through lots of petitions from different neighbors, and we've been working on a sign audit to clear up signs in town that are old, outdated, et cetera, et cetera. School has started, so please watch your speed in the school zones in particular, and the traffic, the speed limit for the entire town, unless posted, is 25 miles an hour.
Excellent. Anyone else have anything else? Dawn?
Just a quick note that Theater 370 will be putting on a production of Chicago auditions. So this is at the high school, and auditions are next week. High school athletics are underway with first games in most sports this week. Matchups against Ashland, and the number of sports have already happened. And the first home game is is Friday evening. So come out and support the teams.
Excellent. And I just have one update, which is that the middle school PTO is having their first meeting of the year. It is Tuesday, September 14th at 9 a.m. via Zoom. The agenda is posted on their webpage. Okay, central administrative comment.
A couple of things I could probably talk about later in the agenda, but I'll mention just because I'm excited that the Opera Steering Committee did approve yesterday the $100,000 to fund our after-school and before-school literacy, numeracy, and social emotional learning groups. So Joni's going to be working on having the administrator do some STAR assessments, and we'll put some groups together, but that will be pending the select board voting to approve that on Monday night. So we're excited that, again, the town is very supportive of helping us with the ARPA funds after already helping us fund full-day kindergarten. So we've been really pleased with that. And then I do want to mention the traffic flow. Mr. Boudet and myself and Chief Cassidy and Chief Stone are meeting next week to discuss the traffic flow. We have had obviously a great influx of cars. We do have a lot of students on the buses, but we still have a lot amount of cars, and our kindergarten class has increased in size. So with enrollment changes, COVID changes, all these things, it has created traffic flow concerns, and we're going to work as a team to try to come up with some other solutions. But I will say, Placentino being the last school has had the most problems, and they've done an incredible job. We've been helping out after school, and what they literally shaved about 25 minutes off what the first day was. So I'm hoping we can shave a few more minutes, but I have to say kudos to the Placentino staff and administration for being able to get it down to where it is. And I think 3:46 about we were out of there today. So, it is going in the right direction, and we'll work further against that as well.
Anyone else? Mr. Boudet? Joni, do you have anything?
I'll be presenting in just a little bit.
Okay, I did not have anyone that registered for public comment this evening, so I will close out communications. So we'll move on to presentations. So
There you go.
here you are, you're up. Ms. Manon.
Excuse me. Yeah, sure. Okay, thank you. Oh, not share, present. Sorry, everybody. Okay, so the superintendent asked me to do 2 short presentations. The first one's on our new hire update for the school year. So if you break it down, let's see, I need to move these guys somewhere. I move them to there, I'm just gonna move them to the top. Okay, so I broke it down by each school and central office, how many teachers, peers, and other positions we have hired just for this school year. You can see as a district, we have hired 38 new teachers, 16 paras, and 22 other positions. Example of another position is myself, Jeriel, lunch monitors, adjustment counselors, things like that. So these are 2 different pictures of our incredible group. Mrs. Raffy took these pictures, I think. Yes, and so this was our first and second day of training. So we have an incredible, very spirited, high energetic group of incoming teachers. Very excited. So this was the first day of new teacher orientation that Darkeska was presenting to our group, and Jeriel was presenting another day. He was catching up teachers on the presentations for equity that had taken place to all teachers last school year. So all of these new teachers have now been caught up, which is very nice. Recognize yourself there? So, sure. Yes. So these are the topics that we did cover within those 2 days. So superintendent welcomed everybody. I went over the teacher evaluation and SMARTY goals that's required by all teachers. Mr. Bidet went over the finance and operations. We had a visitor from the town of Holliston go over the benefits, and they could ask questions. Dan did district technology. A new teacher institute overview is our 3 assistant principals that are spearheading the new teacher institute. Paraprofessional support overview, Kelly Camp went over. Principals' remarks that first day at lunchtime, all the principals got up and to introduce themselves. And as I said before, Jeriel and Karen Archibald did together equity and implicit bias training, and that was a training that all teachers had received last year. Bus tour, Mr. Bidet did, and along we had a social afterwards, which everybody really enjoyed. So the second day, the superintendent started with charting the journey in our strategic plan. Kelly Camp went over special education, just a big overview. And then our 3 assistant principals went over the mentor-mentee meetings. And then they were able to go back, the new staff were able to go back and meet with their mentors. And then they had building-based meetings after school.
Just pause for a second.
Yes.
So one of the things we've tried to do this year is add paraprofessionals and other new hires to this training. It's necessary for teachers as part of their DESE licensure, but then our paraprofessionals weren't getting onboarded, so we added them this year, and we've also offered to include them and pay them some of the equity training that we're doing this year. So we're excited to be able to offer some of that to them, and that's something we're going to continue to expand upon.
And we have asked for feedback, so we will take that feedback and improve on it next year. People really did love the tour and the social, just having the opportunities to interact with their cohort and with their new colleagues, so that was
I
nice.
saw a lot of negative comments about the tour, I'll just say, so we may have to read.
I think there's some outlook going on
I
here.
heard you quite enjoyed it, even though you said you did not want to do it. So.
Yes, somebody's quite the hand.
Did you learn
But
anything special about Holliston on that tour?
Yes, I
Anything-
did. I learned a lot.
particular?
I did, no, I learned a lot. We went by, is it called Balancing Rock? And then help me out here,
Littlefield Tavern.
Littlefield Tavern, so I remember those 2 things, which I did not know prior to.
Yeah, I don't know what Littlefield Tavern is.
I actually don't know that one either.
Me either, so we're gonna have to go to the park.
Balancing Rock gave up on 2020.
Balancing Rock became completely unbalanced.
That's right.
But it is nice as a person that does not live in this community to be introduced to the community and get to know your way around.
Yeah.
Because you come in the same way every day, like I did, so it's very nice. But they all enjoyed that very much so. And then this is a very quick review of August 31st, our Professional Development Day for all teachers, and this is all staff. So yours truly. So our school committee chair welcomed everybody back, all staff back in the auditorium. And then Dr. Kiska introduced all our speakers. We were very fortunate. Oh, I'm gonna have to move you guys again. Hold on a second. There we go. Okay. So we did have our keynote speakers, Dr. Henry Turner, just to let you guys know a little bit about him. Some of you guys were able to stay. So he has been a high school administrator for over 15 years. Last year, he was the principal of the year. He is definitely recognized for his inclusive leadership style and really championing student advocacy. He is definitely committed to increasing our digital future by creating equitable opportunities for all. So the talk he gave was an hour. He entitled it "The Educator Who Commits to Equity." And basically some of the big points that he talked about during that time was equity, why we all need to be involved. Doesn't matter what your role is in the district. What does it mean to be a Holliston educator and for equity? And then he started a big discussion on the importance in establishing shared definitions and common language that we're all gonna, so when we're talking, we all have a definite understanding. Later in the day, so we had 2 different groups. We had a secondary group and a elementary group. And Dr. Khalees Warnham, who has returned from last year, she came back. Just so you guys know, she used to work in the Brookline Public Schools as the Director of Educational Equity. But she now has started a consulting group, KW Diversity, and she's the lead consultant for that. And just to remind all of you guys, she did lead a lot of professional development for the district last year. So we are continuing our relationship with her. Her talk to everybody was entitled "A Year-Long Journey of Building Authentic Connections Through Equity and Cultural Proficiency." And she really established that shared understanding of what cultural proficiency is. So everybody left those talks with a very clear understanding of what that meant and what that means in their specific classrooms. We did a lot of back and forth and parent shares, discussing with each other what that meant. And then we had a shared development of culturally relevant framework. She has 6 guiding principles, and we went all over those and what it means in our classrooms, and it's all about building authentic relationships, and that's how we start this work for everybody.
And actually, Henry Turner's presentation was recorded, so I will share that out with you and we'll share out to staff that didn't get to see it as well.
Thank you. And just so you know, she is going to be continuing, coming back to us at different dates this year. So she'll be continuing the work. So then the rest of the day, when everybody was together for the keynote, and as I said, there was a secondary presentation Dr. Khalees Warren did, and an elementary. And when they were not with Dr. Warren, this is what the schools were doing. So Placentino and Miller were together. They were working with an outside consultant, Cynthia Merrill, who they worked with last year. She's working on them with Fontes and Pinnell and the benchmark assessment system, or BAS, so that's how I'm going to refer to it. So she was working on training them. She's reviewing the BAS levels with all the teachers, so there's a common understanding. They're all using the same evaluative forms, believe it or not, even though it's the same company, there's multiple different versions, so everybody's on the same page. These are the ones we are using. And then we were talking about how those BAS levels, once they are determined, are going to be used as data points and determine how to group students. At RAMS, when they were not in those presentations, Principal Jordan, Vice Principal Beatty, and SSA Murray were running equity training. They were talking about equity priorities for the year for RAMS, and also they did an activity, basic principles of equity literacy. Then they went on to talk about in the afternoon later skill regression and intervention, and how they're going to address that, not only in academics, but as SEL. So how RAMS is going to address that, and then how they are forming the COVID recovery planning groups. And finally, at the high school, they continued work with Principal Bottomley on vision of a graduate. Then they were able to have some department time, debriefing the keynote speaker and Dr. Warren's speakers, and also vision of a graduate, and then starting to collaborate on their department goals. So it was a very full day, but very productive. And the feedback that we have gotten from teachers has been very positive about both the keynote speaker and Dr. Warren. So, any questions?
John? Do you do a survey after?
Yes, we do.
Had positive feedback.
Yes.
So that's from a survey.
Correct, from teachers, yeah.
Okay.
And that was developed, just so you guys know, last year in a PD steering committee. And so once I start that again this year, we're going to revisit that and make sure we want to use that same tool. But they took some time developing that, so I'm assuming we would want to use that same tool. It's the same basic tool for all schools, and then it's broken down to some more age-appropriate questions for the various schools.
Anyone else have any questions? Dr. Savard or Ms. Koshin, do you have any questions for Ms. Menard? Well, thank you for your presentation.
You're welcome.
Let's see, next on our agenda we have, I don't have any policy for this evening or personnel. So I guess we can start with our reports from the subcommittees. Do you have anything to report from? We're not doing a newsletter tonight, are we?
We are not doing a newsletter tonight. Do we know when the next meetings are? I know communications is meeting on Tuesday next week.
Okay, that's what we're
Policy
starting
have an upcoming meeting?
Yes. It is potentially the 24th.
Potentially the 24th.
Okay.
No.
I'll take a look.
This was just decided.
Okay, so the 9th for
You're like-
communications for next week?
Yeah, Tuesday.
For Tuesday.
Except that that's Rose PTO.
That's not the 9th. That's the
It's the
14th. Sorry, I have to, I don't know what I did. 14th. The PTO is at 9.
I know.
Okay.
The meeting's at 9.
Okay, well, I'm going to the PTO, so you're covered.
Yeah, but yeah. Well,
I mean, I know you probably wanted to go too, but
I kind of want to go to the
All that
PTO
day.
too.
Okay,
Till
so policy 924.
Yes.
Tentatively.
Yeah.
Okay, you're gonna have to let us know. Okay, budget, Ms. Koshin, do we have another budget meeting scheduled?
We don't have one scheduled. I'm going to have to do, I have to go to the finance committee to present our, whatever we vote on tonight for our capital budget next week. But we don't have to meet as a budget subcommittee until after that. So maybe the following week we can schedule one.
Okay, but we're all set in terms of, for town meeting at this point. We've already made our request.
No, we have to vote our recommendation tonight. I think you have that on the budget. I mean, I think you have that on the agenda coming up a little bit later.
Yep, I beg your pardon. Yes, that's correct. Okay.
So, yeah.
And I'm assuming no superintendent's evaluation, although there is supposed to be a program that's being run. I think it's via Zoom. Stacey, did you sign up for that program about superintendent's evaluation?
Yes, on the
upcoming?
17th.
Okay.
Yeah, on the 17th, I did.
So you already signed up for that? Okay. Nothing? I guess at this point, I don't know what else.
If they want to watch, they can always go.
They can watch it. They
Facebook page or.
can, yeah,
or
watch it on
TV.
Facebook or on chat. Okay. All right. Okay, so Dr. Kuska, we're into old business. We have superintendent's update.
Okay, I have a couple of things I wanted to talk about tonight because I know people have had a lot of questions and we're still in the process of working out our protocols for the test and stay procedures that DESE implemented and we applied to be a part of. We were able to, our nurse leader, Mrs. Jordan, and I were able to connect with our program coordinator over the holiday weekend. Thank you, Missy, for being in Florida, getting your son to college and still jumping on a Zoom meeting on
Oh
the
my
holiday
goodness.
with me, because that's how she rolls. But anyhow, we are able to start with our Binax testing, our rapid testing, which is the test and stay protocol. It actually worked out really well that we had some leftover Abbott Binax from last year. We had some students, as you saw me report out, that did in fact have to be tested as close contacts. We were able to send out the consent form to those parents immediately, get them to consent, and we were able to start the test and stay protocols on Tuesday and the rest of this week so that those students can stay in school. Right now, if you have a student or staff member that has been within 6 feet of a positive case, if they test and stay for 5 days, they're allowed to remain in school as long as they're asymptomatic. Also, if you're vaccinated and asymptomatic, you may stay in school and do not have to test and stay. But we do need parents to consent to the test and stay protocols, be part of that. We also have the ability, if a student or staff member comes to school after their arrival, becomes symptomatic, we can test them on the spot, again, as long as they have consented to do so. So right now, parents received, as of yesterday, a link that is provided by DESE through the CIC. It is not our procedure, it is the state procedure, but to enroll in the consent, you have to put one link to all three procedures, whether it's test and stay, symptomatic testing, or pool testing. So your consent is for all three. And I've had parents already question as to what if I want my student in the pool, not in the pool testing, but in test and stay and also in any symptomatic testing. They all help us mitigate. So each one serves a purpose. One, obviously, to identify a positive case immediately if they're on the spot. Secondly, to allow students to stay in school if they continue to test for 5 days. But the third is the preventative piece, having pool testing weekly. We can test as many students as possible and identify any positive cases that are asymptomatic so that they can get off campus to ensure that others don't become symptomatic as well. So all three together are recommended by DESE. They are a little backlogged. I think there's about, I forget how many, most of the state, I feel like it was 90% or something of schools are taking part in this because it is provided through the state. That being said, we're not ready to roll out the pool testing and haven't really made a decision about when we're going to use it because the state is really not ready to get that testing to us yet. So we have a little time to figure that out. Certainly welcome to hear your questions about that and any input that you wanted to have. But I will say I'm already hearing that some parents are resistant to potentially doing the pool testing, but do want to do the other testing.
Can I ask a follow-up question to that? Could you maybe explain a little bit more, and this might be for all the parents to hear, I know last year there was a lot of concern that if you participated in pool testing, there'd be a higher chance that your student would be identified with a group and would have to miss more school. So I think a lot of people sort of associate pool testing with a higher likelihood that your kid will have to stay home. Now, I understand that might be a little bit different this year because of these other things. So I was wondering if you would maybe speak just a little bit to that. Is that a legitimate concern, or is that something that we should think differently about this
I
year?
mean, there's always a possibility that someone is asymptomatic in school and is positive. I mean, that is an unknown. The Delta variant, as you know, is spreading more quickly than other variants. So ideally, if you are positive, we do want you off campus because we want to avoid others becoming symptomatic. So I know there is that fear, well, my child's asymptomatic and I want them to go to school, but your one child could then get how many?
I mean, like,
so there is that fear, I know
Yeah.
from people that, what if my child now gets identified as positive and now has to leave school? That is true, that can happen. But you can also prevent a lot of other children from becoming sick. And the sooner we get the child off campus, the sooner that they can get starting to relax and rest and get back to school safely. So I do know that that's a concern parents have. And I think we had, out of all the pool tests we did last year, did we have 2? I'd have to double check that, but we only had, I think, 2 positive cases from all of those pools that we did last year. So it still is only identifying a very small percentage.
And didn't the pool testing identify someone was positive with the pool, and the rest of the pool did not miss school because you used the rapid?
That's what I'm asking. So if my kid is actually negative, but they're part of a pool that was positive, and my negative child.
Right. So if we get a positive pool, then we individually test all of those children, and all of the others can stay if they're negative. And that's where the test and stay would come in. So now I find out I'm in a classroom with 20 kids, and one student did become with the pool, came out positive. Now I can say, okay, who would have been close contacts? I can then again go do test and stay for any close contacts. So it allows us to keep more kids in school overall. And that's why they do go hand in hand. I know people don't always see it that way, but they really do all intertwine.
So just to clarify, I'm sorry, I just know this is a really issue for parents. It sounds like if your child is negative, but they were part of a pool where someone else was positive, your negative child really does not have to stay home because they will be identified. They'll identify who in the pool was positive quickly enough so that your negative child does not have to miss school.
Right, exactly.
Okay.
And that's the goal of all of this, to keep kids in school and staff in school, even more importantly, which I want to talk about.
And there is a decision tree that was sent out with that, right? I remember I printed it.
It is confusing.
The flow chart.
The flow chart, and I was on a webinar with Desi today, and I did put in the chat, could you please streamline these flow charts? Because it's confusing to people. It took me many times with our nurse leader, we kept going through and making sure we were understanding it as well, because I don't want to miscommunicate either when we're trying to support people.
So then can we go through the test and stay process like one step further? So if this pool here, there's a positive person, we each get tested. And so do we stay in a room, like, do you separate it? I think this is some
Yeah.
questions too, like, do you then separate out who, what is it?
So I'll give it how it worked this week. So we had a student who a parent communicated was symptomatic. So student was tested outside of school in this case. We got the positive results back. That meant we then identified any close contacts. So that it was close contacts from the lunchroom and or classroom. There were 7 close contacts identified within that 6-foot area of that student. So we were able to get consent, and all 7 of the students are still in school and just getting tested every day for 5 days. Now, because of the holiday, I think they only have to get 3 days this week, but that's really the benefit of this, that
Right.
last year, if you recall, those 7 students would have had to go home, and they would have had to wait till day 5, then get a PCR test, and then if they were negative on day 7, then they could go back on day 8. Now, those students have not missed school because of this.
That's great. I think that's what we had to focus on, is that it
So I
is keeping
think-
our students in school.
Can I just quickly, I think I kind of got one question here is that, so when you identify a particular pool on a day, do you take them out into a different classroom until you're getting the testing done, or are they still in?
If they're asymptomatic, if they're not positive or symptomatic, they are allowed to come to school like every other student. They test them as they come in, but they can stay in the classroom.
I see.
So that's the big difference this year.
I just wanted to comment that I filled out that consent form today for my children. It was very simple. It did not take a long time. So,
Yes, we really need people to participate in that, because in the event that you don't consent and your child is a close contact, then I have no other choice but to quarantine. You know, that's the downside of all of this.
Lisa, did you have a question?
Yeah, so it sounds like we're not going to be able to get pool testing up and running for at least another couple of weeks. Do we have any kind of estimate on when we might have pool testing available?
We're waiting to hear back from our coordinator, but we have not gotten a definitive on when it will be available. But then I would want to talk about who should we pool test, because my worry is, you know, already hearing from some parents that I won't pool test, but I will test and stay. It's one consent, so how to separate is going to be very challenging. We're down to this year, we had 8 nurses last year. We hired extra nurses with our CARES money and different things. And this year we have 6 full-time people. And, you know, that's really going to be challenging. We're already struggling managing this just since school started, the amount of work they're doing. And so Keith and I are working out to see if we can actually hire more nurses somehow. I don't know where we'll get the money from at this point, but with that, if we start pool testing on top of the test and stay, I definitely am going to need more staff. I can tell you that.
So you said that as part of test and stay, if you're vaccinated and asymptomatic, you don't have to test.
Correct.
Would it make sense until we get pool testing to test even those people? Because I know that there are a lot of asymptomatic people out there who could still spread it. I mean, I know people who have gotten it and been completely asymptomatic. I'm sure we all do. And, you know, the science says they can still spread it.
Yeah, we right now we don't have the capacity to do that, and it is not recommended by the protocols. So we would be rewriting the protocols. I mean, if that's what you're asking us to do, but I honestly don't think we can manage it from a staffing perspective at the moment.
Could we offer it as optional? I mean, if someone I just feel like, I think we really need pool testing in place. We already have positive cases, and we know that especially vaccinated people might be asymptomatic. And we also have a large population of, you know, kids in town who can't yet get vaccinated. So if we can't get pool testing in place, it seems like we would want to at least get, you know, better availability for the rapid test, the Binax test, until we can get pool testing up and running.
Yeah, before I can promise that, Lisa, in all honesty, Keith and I have to identify a funding source to hire more staff. We're already trying to get, the next thing I'm talking about is vaccinations. In addition to all this testing, the nurses are going to have to start getting all the vaccination records uploaded onto SNAP for all students, so then we can tell what percentage we have. That in and of itself is a yeoman's work. Last year, we hired someone coming in multiple days because they were collecting all the flu vaccinations. And how long we kept Peter in the district for quite a while last year. That was an addition. So we had 8 full-time nurses and then an additional nurse coming in 2 or 3 days a week to do all the flu management, just vaccinations. So I don't even have enough staff to manage the vaccinations and the test and stay, and then, you know, pool testing. So that we have to figure that part out before I can have them take on more.
Are we mandated to collect the vaccine information?
We're not mandated to collect it, but if we have to start identifying, like at some point, we have to decide what our mask policy is. Right now, we only have till October 1st that the state is enacting full masking. So in order to determine what our metrics are, with what I'm hearing is 80% would help us make decisions for mask policies. So we would have to know what percentage we have to even make decisions moving forward. So I'm recommending that we do collect vaccination cards from students and staff.
Okay. I know we know that of those who have the option to get vaccinated, we know we have pretty high numbers, which is great. But I don't know, I would feel like it's more important to put the energy into promoting pool testing and making sure people don't spread it, you know, whether they're unvaccinated or vaccinated, because I think we have really good numbers in Holliston from all the data points that we've seen, which is terrific. I mean, we know that that's one of the best things we can do to control the virus, is to have as many people as possible get vaccinated. But I'm worried that, you know, until we can have our younger kids vaccinated, we still have a pretty big risk of people spreading it. You know, even people who are vaccinated, even people who are asymptomatic. So I don't know, personally, I would want to prioritize the pool testing.
It's very short time, but we haven't identified any spreading in school yet. Anything that has been tested positive so far is from outside of school contact. And in all honesty, what we're seeing is family contact. So a member at home, that's where they're seeing the spread. And that's why if somebody gets exposed outside of school with these test and stay protocols, if you got exposed to, let's say, your sister who tested positive, that person cannot test and stay even if asymptomatic, because that's an outside of school situation. And we know that things spread within homes much more easily than they do at school because we're wearing masks at all times. So we are seeing the mitigation right now is still working in that area. So all of these things are being discussed and we'll work on the staffing part. I do think we need to collect the vaccinations so that we also have a handle on what we don't know is our school choice students. They're in different towns. So that's where these percentages are misleading as well. And a lot of our staff aren't Holliston residents. So we have to collect those manually in order to get that information.
Okay, Dawn, go ahead.
Is there any available CARES or ARPA funding to help pay for the nursing staff to collect the vaccination records and also to be working on the test to stay and the pool testing until we hear more from DESE? Because it was my understanding that DESE would provide some sort of staffing for these programs too. Is that correct?
Yes, and we tried to dig into that. I'm not confident yet that that will happen.
Okay.
We talked to our program coordinator, who was lovely, and asked her, so how do we get someone on site? And what we got was that if we called her on a certain day, she might come. But I didn't even know how many districts she's attached to. So it was a little misleading. Initially, it sounded like they would provide someone on site to be with us. And then it sounded like you call and get help. It's too late to call. You know, we have to do that right away and then have it. So, you know, for example, when we get positive cases, they have to do all the contact tracing, then they have to get the consent, start the added Binax testing. So they're already way ahead before we could get someone on campus. So I don't know that that's going to work in the way we were hoping.
Is there a way to request her to come for mobile testing for pool testing program, or can we look into it? So that's one question. And the other question is, are there any available ARPA or CARES funding left to help with increasing the nurses?
I don't think there's any town CARES fund left, Keith, is there? And ARPA funds, you can always make a motion to request more money, but I will tell you after our ARPA, I don't know, Cynthia can as well. As of yesterday, it was very tentative as to whether they would approve us moving forward with the our learning groups before and after school with that 100,000 that you had asked for, because they were worried about the schools who haven't gotten already at 1,650,000 for full day K, plus now the 100,000. So I'm not suggesting don't do it. I'm just letting you know that I feel like we're going to be asked to hold off for a little bit because of all the other things.
Yeah, I would like us to consider it, because what we're hearing is how important it is to know who's vaccinated, so we know who to do test and stay with and who not to. And also, if DESE is going to change the mask mandate come October 1st, families are going to want to know what the percentage is of staff and students. So it is important.
Yeah, we do need that information for sure.
So I think it is something we should be requesting from the town. I know we've had a lot of asks, but we've had a lot of needs too.
That is true. I will tell you that the feedback that I got from the ARPA steering group was that they wanted to slow, they've already encumbered 40% of the funds that we've been allocated at this point. They wanted to kind of slow down the pace and take some time to look at these things that are going into the warrant. And I think they're looking to wait until after we can go through our fall town meeting before we look at any other requests.
So my only other comment would be, if DESE set up a link to collect consent forms, why haven't they set up a link to collect vaccination records? And if they haven't, can we ask them to?
Sure, but I just don't know if they're going to do it. I mean, we can ask, but it's been a little haphazard. I think they were overwhelmed, just like the rest of us, trying to get this all up and running. And it was, in all honesty, a little delayed. We were working on our mask policy before DESE implemented theirs, and that should have happened first. So yes, we can ask. I can't be certain that will happen, but I will tell you, for staff, as of tonight, we did send something out to collect vaccinations. with our new unified talent, which is attached to Power School. We have the ability now for staff to upload a copy of their vaccination card, and then I'm having them check a box to say, yes, I have been vaccinated, and they have to sign off in there. So they just got this tonight, that we need to collect this information, because I also need to know who's a close contact that is vaccinated or not vaccinated, because that also helps us figure out our next steps, this, for this whole process. So staff are going to have to upload that by September 30th. That is an electronic system that will work, I think, very well for us. We don't have that for students right now. It is manual, because what happens with the nurses, if they get a physical form or there's vaccinations from the doctors, all of that's uploaded manually. There's no way to go.
Okay, I do have a question about that. So we do have the Power School system, and you can upload things onto that. Is there a way for us to create a field within, when students had to get their new registration for the year, and you had to verify all that information, could you upload your health record? I was able to upload health records. It's, I think would be feasible to actually use a field for uploading your vaccination card.
It's possible. The issue I have with that is, right now, I'm just asking certain things about who is and who's not. That's not protected by HIPAA to ask if you are or not. If you start getting into anything more medical than that, like I'm worrying about who has access to that. See, the nurses are the ones that need that information, and I can't give them access to all the information on Power School. There's no way to limit that. That's what I would worry about.
Okay.
Because they're using SNAP
Right.
for their
They
normal.
need it in SNAP, so even if I put in Power School, they still
Everything
have to
has
enter
to
it in
be
SNAP.
transferred.
Yeah.
Okay.
Yeah.
Not seamless at all.
Yeah.
Because my thing is, like, someone can take a picture of that card, someone still has to look at that. Is it that name? Is it that,
Yeah,
Someone has to verify it.
Oh, yeah.
just like they verify our health records the same way.
That's why it has good visibility.
Yeah, and right now, some are getting it at their pediatrician's office and some are getting it through any other COVID site. So it's not all in one database for the state either. That's the other problem with that, which is why we have to rely on cards right now. So I did already mention the vaccinations, and it did go out tonight that staff are going to be uploading to verify that they are vaccinated. You probably have heard that the federal government, as of today, are expecting that all federal employees are going to have to attest and demonstrate that they are vaccinated as well to remain employed. There also are some discussions at the federal level about anyone that is receiving federal funds and has more than 100 employees would be asked to prove vaccination as well. At the state level, Massachusetts has already required that anyone that works for the state does have to prove that they are vaccinated to remain employed. So I do think my worry here is if we don't have staff vaccinated and then we get a positive staff member, we now could lose that staff member and 100 kids have no teacher at the high school potentially for their classes, or 25 students in an elementary setting. We don't have a backup plan. Last year we could do remote. We don't have the ability, we don't have the staffing. We don't have a way to Zoom kids in. We have not bargained that because there wasn't a need to do that because we were told that remote is not an option anyhow. So I really would like you to consider having a mandate that staff, as the employee of record, that we can mandate that staff are vaccinated. It would be something that I would want you to vote on. And then we would have to bargain the impact of that.
John, go ahead.
Okay, so I know there are some school committees like Newton who have already enacted that policy and have reviewed it, but that was prior to the speech today. So if we receive federal funds and we have more than 100 employees, aren't we covered by what came out today? Isn't it already required? Do we need an overlapping policy?
I didn't get to listen to the whole thing. I'm hearing people are
Yeah.
misinterpreting it, so I don't want to speak to that specifically. Because at first that's what someone was saying to me, and what I also heard was only if it's a federally funded school, which means like school-wide it would be federally funded. So it may not be schools that just, but I think that's the direction that we're heading. It just could take some time before the federal government gets to places that they might say that you no longer can get the federal funds if you don't have all your employees vaccinated. And then that could be like, maybe in December we find out, uh-oh, now what,
Right.
And I understand we have to bargain it, but have you had any conversations yet with any union representatives to get their point of view on a mask mandate for staff?
A vaccination.
Vaccination, I'm sorry.
I have had preliminary conversations and I let them know that I was going to be having this conversation with you tonight. And I think in general, people want everyone vaccinated. But as far as the bargaining piece, that also is a group ratification. So, there may be some concessions that are asked for at that point, but I would say that to me, starting with it tonight, you could do a policy as well, but you also can just vote that we mandate it and then work on the policy to have the right word.
We're the employer of record. Go ahead, Amanda.
Okay, so are we talking about mandating it for everyone or mandating it with the option of if there's a reason you cannot get vaccinated, a medical reason or something like that, you can instead opt to get tested every 7 days and submit those results?
Medical exemptions are always a possibility. They would have to then come to me with the medical exemption reason. And I will say, medical exemptions are also small, a very tiny percentage of getting that. Right now, we have one student that's a medical exemption in the entire district. So, and that's for mask wearing, that's not vaccination. But in general, those are not that common either. I think that people assume that it's a wide berth. But yes, medical exemption would still be part of that, potentially.
That concerns me a little bit just because I guess I would want more clarification on what would constitute a medical exemption and.
But that's up to the doctor to tell us.
Yeah, that's up to the doctor.
I don't determine that. The doctor sends to me documentation. It's not my expertise.
I also shared with Cynthia, I want to take a pause before we just jump into a vote on mandating vaccine and stuff, and that's not for, tonight. I'd like the opinion of our attorney. I would like the opinion from the Department of Public Health. I think we just need to take a step back and think, what does this mean by us mandating this? What are we doing for the future? And this has nothing to do with pro-vax, just want to take a step back. What we do now sets precedent, and let's think about all of the ramifications and what exactly are we mandating and not. I am concerned about this a little bit.
Let me just clarify, because I did speak with our attorney as well. So when you put forth, if you did put forth that you would like to consider mandating vaccination for all staff so that we don't have staff going out and not have people to teach our students, it's then subject to bargaining. So it's not a done deal. So through the bargaining process, then we would determine whether we'd go that direction or would something be asked as a concession in that part. So it doesn't mean it's going forward automatically. You would still put in that caveat.
We would vote that, an alternative testing requirement would be subject to bargaining. So go ahead, Donna, then I'll just share my conversation with everyone.
And under our current policy, we have a policy to cover specific vaccinations for students. Are they also requirements for staff? They are not. What about last year when they enacted that the flu vaccine was mandated? Was that only for students?
Yes.
Okay.
Tried to get it for staff and there was so much pushback that it was not, didn't go through.
Okay. So I did speak with our attorney today. He said as the employer, the EEOC has stated that we are allowed to mandate as the employer for our employees to get vaccinated and provide proof of vaccination, meaning their card. And it will be subject to impacting their working conditions. So they will be allowed to have a medical exemption. However, there is in the Massachusetts state law, it says in terms of religious exemptions, in absence of a pandemic or other emergency, you're allowed a religious exemption. So that would not count because we are currently in a pandemic. So it is really the medical exemptions that we have to consider. And then we need to make reasonable accommodation for that, which would mean, they could say, well, they'll wear masks and they'll get tested weekly as a mitigation strategy for that. I also mentioned about precedent setting, like are we setting a precedent? And he said that he felt that we needed to keep our options open and that he certainly did not think that this is a extraordinarily unique circumstance that a lot of people are grappling with this and how do we move forward, and certainly asking for vaccinating this is something that has been going on across the country. And he did not feel that this is simply COVID related and does not need to be as a ad hominem every single, am I saying this for everything else, for every other vaccination, it's specific to COVID.
Cynthia, in Lexington, I know, is mandating vaccinations, but they did not do a policy. I don't believe you need to do a policy. I think you need to vote to mandate it. It's not a bad idea to have the policy, but that's not necessary.
It's not required,
Yeah.
yeah, so he said we could vote. Yeah, so that was about the teachers in terms of, but we will have to bargain whatever those consequences will be, which would be if you can't get vaccinated, that you would, you would wear a mask and you would get tested weekly, essentially. Go ahead, Dawn.
Can we get a sense of how many this would impact? Meaning, I know people voluntarily could provide their vaccination cards up to this point. Do we have any sense of the numbers?
I can only guess based on last year when we were getting vaccines, we allowed staff to go during the school day because whenever you could get an appointment. So many staff took us up on getting coverage during the day and coming back or had to call in sick afterwards because of the vaccinations. So we have a pretty strong sense that we could be up to 80 to 90%. I'd like to say 90%, but that is a guesstimate because I do think we have a very strong percentage in this area, which is great. And that's why I wanted to start collecting the vaccination cards because that might give us a good answer from that. My worry about waiting too long right now is that October 1st date. That's what I'm really worried about because I don't know what the state's going to do and I don't know what the metrics are going to look like. So I felt like if we can get the ball rolling, knowing that it's not a done deal, we still would have to, go through the next phases of negotiating or the impact of that. But I worry if we wait too long, I'm going to be in a position where we have to make decisions and don't have the information that we need to do so.
Amanda?
This is slightly repetitive, but I would feel more comfortable voting on something like this if I had a better idea from you from like how many HFT members would support this or how many we would potentially lose as a result.
I don't think that they know that right now. I mean, you'd have to collect a survey and have, so.
What I will say to that is that when we met with Jamie and Amanda just a few weeks ago, they brought up the mandate for vaccination.
But I mean, the
so
whole
they would
point is
entertain that. So they've been very active over the last year plus about masking, and any mitigation strategy. So they have taken the safety and security of students and the staff extremely seriously. So I do not anticipate a huge pushback from the HFTs.
Yeah, and I also mean part of this is to encourage people that have been hesitant to go that route. I mean, that's not to encourage them to leave. We don't want them to leave.
Right. No. They've been strong advocates to, protecting the staff and the students in this. So I don't anticipate a huge pushback from them.
So the reporting is paused.
No.
Oh, that's awesome.
It's on HCAT.
Okay. Lisa, go ahead.
I would like us to really consider voting on this tonight because I think that we do know that if there are ramifications that we haven't thought of, they're going to come up in bargaining. And to Susan's point, I just think that time is really of the essence. We know now that the vaccine is very effective. The Pfizer vaccine has gotten full approval. It's no longer the emergency authorization. So I don't see any significant risk to requiring this. I am confident that people who needed a medical exemption will be able to get one if it comes to that. But I'm concerned about waiting. I hear what you guys are saying in terms of getting more information, but for me, there's enough information to vote tonight.
Vaccinations on the agenda.
Oh, all right. I'm just trust me.
Yeah.
It doesn't say vote.
Any other questions? Well, I have some language that I spoke with Andy Waugh that he suggested that we, if we were to take a vote, that we vote for all employees of HPS to complete their vaccination no later than October 1st, subject to bargaining with HFT.
How could they complete their vaccination by October 1st if it's September 9th? You mean
3 weeks.
start?
Because if they need 2 doses is what she
We
said.
need 2 doses and
Okay.
we need to impact bargain first. I don't think I've tried, I think we have to change it.
Okay, we'll have to give it, yeah.
Yeah.
So
Maybe we need to go, like,
if we
tomorrow.
impact bargain next week, how much time do we have here?
I also don't think we should make it only 3 weeks for those people who might want to choose Moderna, and it's 4 weeks. So I think we have to give time for impact bargaining if we're going to do this, and we have to allow 4 weeks after the impact bargaining.
1, 2, 3, 4. So by October 14th.
You still only, that's not enough time. So if you're bargaining on, say, next week, right? So which would be the 15th. And then you ask them to get completely vaccinated, you're looking at an 8 weeks frame. Literally.
I would say the end of October.
Yeah, end of
Yes,
October
okay.
would be more
We're staying with
reasonable.
you. Okay. So
We can always
by
change the
October-
date. We can re-vote this in a couple of weeks and move the date if we need to.
Well, I think it's probably good for them to move forward. I think they would want to know. Well, I suppose that could be subject to the date could be subject to bargain. So we don't have to put a date in, consider
You don't really need
subject
to at this point.
to what the HFT requests in terms of a date.
Yeah, I think that would be fair because the teachers would need the time. And
We could recommend a date of October 31st, but leave that open to bargaining. It gets bargained, then we give them 4 weeks. They may choose to get vaccinated on a weekend, right?
Mhm.
Just making these appointments, so there's a lot of pieces to this.
Yeah.
And hopefully by the end of September, I'll have the bulk of the cards, because I'm gonna have to presume if somebody doesn't upload a card, I'm gonna have to presume that they're not vaccinated. They're not giving us anything.
And chances are we'll not need that much time.
Right.
But with the state, like federal mandate coming in today, I'm guessing the vaccination rates will go up because a lot of private firms are also asking for vaccinations. So you can see a lot of like request for vaccination. The spots will be difficult to get, you
Yes.
know.
It's increasingly becoming a
Yeah,
required
and then
priority.
we need to consider that they need 2 to 3 days to recover. So that's also another thing which you would need to kind of take into consideration, knowing that it's almost 80-90%.
One day, sometimes 0. I mean, everybody's so different.
Yeah, everybody is so different,
Yeah,
but
right.
I mean, on an average, say 2 days, right?
Okay, well, then we just won't put a date in.
Yeah.
Susan, what do we require for someone to be employed in terms of health? Like any vaccinations, anything?
We don't,
TB test?
Yeah, like,
Way back when,
we don't get
even
physical
before
here. I've
I
been in
was,
district.
even before I started here, we used to have proof of tuberculosis.
Yeah.
Yeah, and that's, we fall under the town. That's not the school's purview. We follow under the town. They manage,
I didn't have to give anything, and I got hired July 1.
Oh, I'm out of the state.
what, and then, I just,
You're still trying.
And what is the town doing? Is the town requiring that everyone gets vaccinated?
I don't know, but there's a big difference between the town and here. Our commodity is children.
Yeah.
We are protecting children. The town does not have the risk that we have.
That
We
is
have
true.
kids
And I'm
under 12
like,
unvaccinated.
And the town proved last year that they could just shut their doors.
Yeah.
I mean, they.
We can't shut our
shut our
doors.
doors.
We were the only show in town that was open
Open, yeah.
every single day, right?
And to be honest, when I did meet with the Board of Health and I asked them about supporting what we were doing, they said, well, we can do whatever we want. Like, they said, why don't, it's a condition of my employment to get vaccinated. And each one of them had said they're all vaccinated because it was a condition of their employment and that we should go ahead and do the same thing. That was their suggestion. They did not mandate that as part of the town, but that's not my monkey or circus, it's business. So,
It's definitely us.
Catherine is looking.
oh, sorry, Catherine, go ahead. I'm sorry. Just gonna wave wildly.
I was gonna start flailing, but I thought I'd give it a minute. So I have a question about, someone mentioned before, if someone is not vaccinated, that maybe they would have the option to mask and test. And I guess I want to give air to that, kind of germane to what Stacy was saying before, is we know we can mandate this, but should we? And what does it mean long term? And I think that's an important conversation to have. So is this what we're talking about right now? I can't remember who said that, like the masking and testing, because if there are people who can't get vaccinated for whatever reason, they could still be carriers and they could still transmit. And so is there a if this, that, or that, is there an either or sort of option that would be rolled into this?
I would think that would be part of the bargaining that we would have with HFT. But my instinct would be to say yes, if they cannot, or for whatever reason can't get vaccinated or don't want to get vaccinated, they would need to, mask up and they would have to get tested weekly. And that could be a provision, but that would be a discussion with the HFT.
Especially after October 1st, correct?
31st, but we don't need to set a date.
The masking.
Oh, the masking discussion about taking down, like
Yeah, we
removing
don't know
masks?
how the October 1st is going.
Well, we won't know that because we'll need to know whether we have 80% or more, and if we're comfortable at the 80% or not, or there's a whole lot of things that can happen between now and then, in terms of whether or not the approval for vaccinations for younger kids comes out. I don't know.
I mean, if we're gonna automatically go the route of saying, if you don't want to get it, you can test and stay, and now our nurses have to do all this extra work, and we have to hire extra staff because people are making a choice that are putting other people at risk. I don't know. I find that problematic because that's where we are right now. People are making choices to not get vaccinated, and the potential of getting our children exposed increases by that.
And we already had an exposure this summer.
Actually, we've had 2 positive adults as well already this year.
You could have them responsible for getting their own test and providing the results. It wouldn't necessarily have to be, this is another negotiation thing, right? Sure. It wouldn't necessarily have to be provided by the school.
Right, that's why I'm not saying that this is going to be where we end up, but if we don't start somewhere, we can't get the ball rolling. And that's why I'm recommending starting with the more restrictive of everybody needs to get vaccinated, knowing that there are pieces to that puzzle that have to be negotiated.
Right. And then once we do, if we are able to relax a mask mandate, then those people who are unvaccinated, who are unvaccinated would still continue to mask and have to test every week.
Yeah, that's a given.
Yeah. I'm sorry, Dawn and then Catherine. Hold on one second, Catherine.
I was also going to kind of second what Amanda said, which was I wouldn't contemplate that it would be at our expense on our staff and resources to test, but rather you would have to privately obtain the test and provide the results weekly.
Well, that would have to be bargained.
Can I tell you what the concern would be? I know it's too early to say that. Right now, because of the increase in the Delta variant, we've had people getting PCR tested at the moment, and it's taking 1 to 2 days to get an appointment because it's not, and they're saying 3 to 5 days to get results. So here, now all of our unvaccinated people that become potentially positive, if they're testing on their own every week, are they gonna now be out of school every week?
Yeah.
So we have the ability to do it quicker, which would make the most sense because that's the test and stay piece, right? So I would be very worried about if they're on their own trying to do it and they can't get appointments or can't get results. Now we're still down staff, which is what we're trying to avoid during this whole process.
Can I repeat that?
I guess I'm anticipating not that many staff would need to.
I'm hoping that it's, but until I can get all those vaccination cards, I won't know. I mean, I'm optimistic that it is 90%, but maybe I'm overly optimistic.
We have new staff that weren't here last year.
Oh, I'm sorry, Catherine and then Lisa.
My question's been answered. I didn't know if we needed to decide all of that tonight before a vote, or if this was some things that could be figured out along the way.
We need to vote tonight on the vaccination piece. Lisa?
I was just going to say that. I would really like to see us take a vote. I can't totally read the room. I don't know which way it's going to go, but I would like us to at least vote because I do think it's really important that we move this sooner rather than later.
Are you making a motion, Lisa?
I am making a motion to require vaccinations for all school staff subject to collective bargaining.
It's not, well.
Impact bargaining.
Impact bargaining. I'm sorry.
And is that with a tentative date of October 31st for compliance?
Yes, with a tentative date of October 31st for compliance.
Well,
Yes.
so I was drafting here. I'd like to actually include something about COVID-19 and that it's specific to this, and this is why we're doing it.
COVID-19.
Sure.
That is what I want. Because
Absolutely.
otherwise, I think we're.
Lisa, are you okay with Stacy amending your motion?
Yes.
Stacy, do you want to read what you wanted to put in? I'm sorry.
I think Susan changed it, so I think she said it was better, so. All employees of HPS will complete or have completed a COVID-19. I want to say something about this due to being in a pandemic is what I'm trying to say.
Okay.
So I guess due to the COVID-19 pandemic, all employees of HPS are to complete vaccination at a date determined through impact bargaining.
I think it should
I
be
just, we'll say the 31st.
vaccination and provide proof of vaccination, subject to impact bargaining with a tentative date of October 31st. We have to at least suggest something. And then if there's a concern that that's not enough time, that's something we can.
Okay, Stacy's right. We want to get it right for posterity, Lisa.
So then the medical exemptions piece will presumably be dealt with in impact bargaining.
Correct.
Who is going to review the medical exemption piece?
Typically, they come to my office and I sometimes meet one-on-one with staff to have ADA discussions about accommodation. We go through the ADA compliance if that's necessary.
Okay.
And then if it was something that I felt like I couldn't determine, then I would always bring it to a lawyer.
Andy thought this would be like 1%. That's what he said, in terms of people that he thought. And that's a very small percentage that he thought would be qualified for that, or would even request it. He didn't say 1%. He said
A small
percentage.
amount, yeah.
A small number. A handful. Okay, and just also for the record, each one of us has provided the schools, because we are in the school building, I should have said this before, that because we are not allowing visitors per our protocol who are unvaccinated to be in the buildings, all of the school committee members that are present have submitted their vaccination status to the schools. So I just want to put that out there on record.
All right, so Keith or Susan, officially, do I amend Lisa's
We
motion?
haven't voted on it yet.
We didn't vote on it yet, so we're gonna.
Vote hers?
We didn't vote hers.
It wasn't seconded yet. So.
You're right, and it wasn't seconded. Lisa.
So you can just amend and then.
We're just gonna amend it,
All right,
so
so,
then you can second it, it'll be like Lisa's motion, does that make sense?
okay. Due to the COVID-19 pandemic, Holliston School Committee requires all HPS employees to be vaccinated by October 31st, 2021. All HPS employees are required to provide proof of vaccination. You need a date on that?
I would just insert COVID-19 vaccination, proof of COVID-19 vaccination.
Proof of COVID-19 vaccination, subject to bargaining with the Holliston Federation of Teachers.
So that's moved by Lisa, seconded by
Stacy.
Stacy. Okay, roll call vote. Ms. Koshin,
Yes.
Dr. Savard,
Yes.
Ms. Bigelow,
Yes.
Ms. Zaborski,
Yes.
Ms. Gupta,
Yes.
Mrs. Raffi,
Yes.
Mrs. Listevnik, yes. Thank you, everybody.
I had a question.
Yes.
When you're requiring a proof, there are quite a few vaccines around the world. I was wondering that if we want to kind of keep it down to the vaccines available in the US in particular.
It hasn't been an issue, I don't think,
Yeah.
but
It's just something like coming from another, perspective. It's something you might want to consider.
Yeah.
I know it's not an issue yet, or.
It hasn't been yet, just because we are not employed out of the country, but I would say that if they already were vaccinated, I don't know that they could get revaccinated. I just don't know that
Right.
that works if they got it in another country. So
Right.
So it's a thought.
something to think about.
All right, so moving on to our next, I'm just checking my agenda is slightly off from yours, so. Opening day report, is that where we're at right now?
Yes, and I did send out, was it Friday? I think I sent out to families some of our opening day pictures, so I didn't want to bore you, even though I know you're not bored with that, but we saw some nice school pictures on the beginning of the year already, but we had some great pictures of our staff and students being welcomed. Our second day of school, we greeted our preschoolers and kindergartners, and there were some tears. There definitely were some tears, and there were some hands being held. And I have to say, I feel like the grandmother walking in the little ones. It's been kind of my favorite part of the day. So we were all trying to be on deck, that all of the administrators at central office were trying to assist with the opening days. And there are still some kinks to work out for sure, certainly the ones with transportation and, the where we have that bottleneck, the town. It's great that we have 3 campuses in one area, and a little over a mile away, we have the fourth campus, but it creates other hazards for us. So there's nothing we can do about the layout. It has its pros and cons, but we will work to try to mitigate and try to reduce some of the bus issues. I may ask Keith to discuss, the late bus and things like that we've talked about. Do you have an update on that?
We're
I
working
know
on,
people are asking about that.
we're working on the routes. We're hoping to get it started next week. It won't be any later than the week after that. We're only gonna, because of the number of available cars, we're gonna have 2 late buses, so the runs will be longer. But at this stage, 2 is better than 0. So it's safe. It's just where it's gonna have to be. So yeah, we're working with home today a little bit on the routing. So hopefully it'll either be Monday or the following Monday. So.
But we do have a lot more students riding buses than we actually thought we would.
Okay, that was,
But we
my
still
next
have a lot of
question. I
cars.
wondered where we were at with that, because I know we were down.
The high school, middle school is close to, if not above, where we were before the pandemic.
Oh, okay.
Wow.
Miller is lower. And I think that's just the fact of parents can drop their children off on their way to work. Like they used to for the high school. And Placentino is right about where it is on a percentage, on where it normally is on a percentage basis. It's not a big difference. I mean, it's a little down, but it's not tremendously down.
Keith, the bus routes have not yet been posted, and we know that you're all working out the kinks. Do you have an estimate for when it might be up? And
Well, there's 2 pieces of that. To kind of let you kind of see behind the curtain a little, we elected to not post the bus routes initially this year for one simple reason, is that we've seen people who like to hop the bus and not pay a fee. So, and now you can't ask a neighbor, but again, it was just one defense mechanism to try to, again, we're the stewards of the taxpayer dollars here. I mean, we have the largest budget in town, and so we use those fees to help offset the cost of transportation. So again, we feel obligated to try to collect as many fees as we should be collecting based on the policies that the school committee has for transportation. So that was one reason. We're doing a major adjustment to the number of routes next week, so we will probably post them the week after. But there'll be with this one bus we're gonna have to turn around, another bus we're gonna have to extend. There's a number of things. Just as people were not sure whether they're gonna take the bus or not, we have a larger number this year of people submitting their requests late. So, yes.
Do you have a method? I just know because one time you had to personally call me at 8 at night yourself because you were handling everything. I don't know if you remember. Is there a mechanism for letting parents know if their bus time has been changed?
The way that we normally do that is, unless it's kind of an emergency situation, we would send a notice home to the parents individually. We may try to use email for that. We're gonna have to figure out which way we're gonna do that. But there would be some sort of personal reach out. We ideally don't want to have to produce a second set of passes if there's a lot of changes, just because it's not efficient to do it that way. So again, I don't actually remember calling you. Thank you for reminding me. I may have worked some night till 8 o'clock. Yes, we again, we're not sure. It could depend on how many people move. I mean, like I said, we do have one route where we're gonna have to do a tremendous amount of reach out, because I believe we're gonna have to turn the route around. I don't see any other way. With our previous bus coordinator is actually gonna be back on Monday just to help us with the routes and the person from homes, the dispatcher from homes, who's doing our other routing now as well. The 3 of us are gonna get together and talk about the challenging routes. So,
Keith, can you just give an update to parents while you talk about the fees on the buses? Because as you know, the reason we started full day K is that we surveyed parents and found out that there was more of a need than we realized, right? So can you just, while we have you on the camera, let parents know if they are struggling to pay, what the means is to apply for aid related to the lunch application, right?
are you talking about for busing?
For busing.
Yes. Well, the state law requires anybody who qualifies for free or reduced to receive free transportation if they're eligible for transportation. So in the case of where, say, we have a full bus and we can't do anything about it, you submitted late, just because it's free doesn't mean you get it. It's you know, and I've actually discussed this exact point with the state, that it's if you do qualify, you get it for free. You can't charge a fee to them. So right now, the state has developed a program, the direct certification program, where if you're with, you know, you're on food stamps or some other program within the state, we get notification as a district on your status. If you don't participate in one of those programs, you'll have to go to our website and go and fill out a free and reduced application. And then our lunch program will make a determination. They're the custodians of the free and reduced piece, because obviously it's spaced around lunch. But they're the custodians, and they'll make the determination on whether you qualify. So
Yeah, I just want to make sure if somebody was, I hate to say, sneaking on the bus because they couldn't afford it, I want to make sure that they know that they can access these things as well.
And we actually have had a large number of families this year new to Holliston, new to the bus process, some where English is not the first language in the household. And we've been working through some of the kinks with that. One family we actually did use an interpreter with. So, again, it's some new experiences here for us, and I think all good ones. But, again, we're working through it. So.
Can I ask one more question?
Sure.
I hope you don't think I'm being critical, because I'm sure this is an absolute nightmare, and I wouldn't even know where to start arranging these routes. Specifically, I have a child in Miller, and a lot of Miller folks are getting their kids on the bus really, really early, like maybe the first or second pickup. And then that child is the last dropped off in the afternoon as well. So you mentioned something about reversing routes. I'm wondering, is there a reason why, or are you looking into not reversing the route so that the first person on in the morning would also be the first person dropped off in the afternoon, making the day length more equitable?
In general, that is what we do. We run the same route in the morning and the same route in the afternoon. There may be a rare occasion because of traffic flow, sides of the roads, et cetera, that we may not be doing that. But I don't know of any routes this year, at least firsthand knowledge of any routes this year that are not just being run.
Right. But I think that's what I think I'm hearing though. So if I'm Susie Smith and I live the furthest away, I'm the first one to be picked up, and then we grab everybody else on the way back. So on the way back, we're coming from the school and the same thing happens. I'm now the last person. Right. That's what I think.
Yeah.
I'm saying that hasn't been our practice. So if you know the route, send me an email and I'll just to confirm it.
Okay.
Because it's also possible, and occasionally it happens, where a route is not being driven as designed. So again, if you can tell me, Miller bus 42, I don't want to give anything away. So Miller bus 42, then I can look into that and either confirm and find it. I may be able to see why or ask why.
Thank you. And thank you so much for all your work on this. None of us can even imagine what it's like to
This is like
logistically arrange this.
But having said that, I know, accepting that, if I may just ask Susan, that are we doing anything about the survey for the school start times?
Yes, if you recall, in the spring, this came up and parents had asked us all year, and I said that it's very difficult with all of the things we were dealing with, the remote learning and COVID, to assess what the stress or trauma, if there might be on a student. Was it COVID related, or was it truly because of the school start time? I don't think we could have assessed that at all. So what I had suggested last spring was I would like to wait until November, December, get us settled into the school year, get a better handle now on with Delta variant as well, and then let things settle down so that we can actually get hopefully solid survey results of what the actual impact potential of start times versus COVID, So that was my plan, and I actually a parent asked that today, and I said that as well.
And maybe we just want to make sure that, I hope you're right, but I hope that COVID doesn't keep that date of November, we keep getting pushed back and pushed back and pushed back, because COVID's not ending, and so I hope that we would.
I think at least though, after this much time and with kids in school, it should be mitigating the impact of what COVID is doing. Kids have adjusted more, in general, as hard as it is.
So we'll be ready to do a survey.
That's the plan, yeah.
Tentative plan. Hope so.
And if I may just add one thing, because many people brought up the thing about the school start time. I do know we've had a number of questions, complaints, queries about that, my Miller child being picked up earlier this year. There's more children on the bus. The runs end up being longer because of that. Last year, we were putting very few kids on the bus. The runs would go by much quicker. So again, as we build these routes, it's the same time to get to, Miller.
Yeah.
When you start adding more children, and each student that gets on it is a 42-second thing, and each stop is a minute and 8 seconds, or whatever the math is of the routing system. So it just backs it up. So tying to that, if anybody does mention to you again, it's just more students on the bus, more stops,
Yeah.
more students, so.
Last year, those buses were very empty. I mean, we saw buses that were rolling in with 5 kids, and we're like, oh.
I also want to remind the public that as this is my 7th year on the school committee, every single September, we have issues trying to figure out the bus routes. It is typical for us to have a couple of weeks adjustment before we, get into a good routine, and there's always shifting around of the bus routes, just tweaks here and there to make them more efficient. So patience. I know we're all asking for so much patience, but we're still in that mode. So, okay. Anything else for opening day report, Dr. Casca, or are we moving on to fall capital?
I think we can.
Okay, so we're gonna move on to fall capital with Keith. Lisa, are you discussing who's taking the helm?
Oh,
there?
actually, can I pause for a second?
Sure.
One thing I did want to bring up, and I had, Mr. Bidet had sent out something tonight, probably right as this meeting was starting, something was going up in the high school related to, as you've been hearing, a lot of more humidity this year. This summer has been incredible. We had furniture packed up outside in our storage units, and then just the way the building's been accessed, the humidity and moisture this year has been incredible. So we have had some incident mold in part of the high school. That is the reason the library's been closed, and we've been having an environmental engineer come in to do testing, and we have multiple cleaning scenarios. But I asked Mr. Bidet to speak to that a little bit more. And anytime we've identified, we have had some surface mold in some of the rooms. So today we did close a few rooms, and we'll get those tested as well. So far, we haven't had any concerns long-term, but the high school will still remain to be seen because it's so humid that the rugs are still absorbing moisture, and it's not soaked up yet. So we really have to do a little more work in that area, but I'll let Keith finish up with that.
Sure, I mean, the first part of the story is sometime mid-August, I was walking down the hallway here at the high school, and they just finished boxing it and stuff. Felt all good, that all looks so great, stuff like that. I turned the corner near Four Corners, and it took all my powers not to go down because the floor was literally slippery with humidity. I was like, this isn't good. And so you move around, and as time went on, little spot here, we treat that. I mean, again, schools, I don't want to jade anybody here, schools get mold. It's something, if you get it in your home, why wouldn't we have it here? And again, you're talking about moist air, that when schools, and again, a common practice in schools, you clean a room, you sit there and you service the unit ventilators, you change filters, you change the belts, you oil the unit, grease the unit, you close the unit, and clean the rooms, wax the rooms, move on, you close the door, and you move on. So now I've got a closed room. Schools in general, all the schools that I know, don't put on the ventilation systems in the classrooms during the summer because they're empty. So why would you be taking up electricity? And so you put all these factors together, and you can get mold. And we've had it time to time over the years, and we treat it in the summer, and usually we're fine. This year, it's been a little worse because of, truthfully, all the excessive humidity that we've had. We're going through the process. We have an environmental engineer who's also our asbestos guy. So he's, again, we've dealt with him over the years, know him well. And, when we see something, we bring him in and we have him test the space. He prescribes a method of treatment for us. Sometimes it's cleaning, sometimes it's bringing an outside service. In the case of the library, we brought in both an outside service master, that's a regular customer, not a customer, a contractor for that. The service master, we brought in, there's 3 dehumidifiers in the room, large industry-sized dehumidifiers in the room, pumping out water into a garbage can because you don't open the window to pump it outside because then you bring in more moist air. Pumping into garbage cans that we empty. Like this weekend, we had staff come in to empty the garbage cans because that's what you do. And we have what's known as whistleblower fans. Have you ever seen them look at a little whistle? They blow right along the ground. So we have probably another 4 or 5 of those in there. A couple of the rooms we're doing the same sort of thing. Some of the rooms we've been able to clean up fairly easily and move forward, and some of the rooms we're just struggling a little more with. And we're going to continue to do that. We're going to continue to monitor. I mean, his favorite word is monitor. You clean and monitor, and that's what we're going to do. So if a teacher reports something, we go down and look at it. If it looks like something we want to either have tested or to treat, we take the class out, we move them somewhere else, and we go take care of it. We're not hesitating with this in any way, shape, or form. Not running from it. And the tests that he's done so far, both, most of them have been what he does, the testing is done where you test the air. You count the mold spores in the air. You see what mold spores they are. None of them have been toxic mold. You test the air, and you compare the mold spores inside to outside, because you're not, mold is naturally occurring in the environment. And so if you have, again, there's plenty of mold outside. Those who have mold allergies can, like those of us who do. But again, that's what he's checking. And if the mold inside is less than outside, you can't do that. We can't beat that. So, and again, we're making progress. I'm not saying that I feel good about it, because we don't want to be here in this situation. But, again, there's been nothing, at this stage that we don't think we can handle in going through the process. And again, we'll work with outside people who this is their job, so.
Yeah.
Is it affecting any learning or?
No, because
Okay.
it's contained to the areas that are closed right now, so it's not, we're not using those spaces, but
So we did have to close, did we have to close any classrooms?
today there were a few
So
classrooms.
we closed 3 classrooms today.
Okay.
One classroom, we don't think there was any, and it's just that it was an adjoining
But the
classroom.
teacher reported it, so you wanted to check it out.
So we do, exactly, so those 3 classrooms are being treated tonight. And actually, based on the type of mold, and speaking with our environmental engineer, he does not believe testing, he believes, again, monitoring, just to see if it comes back, but he felt that this was barely surface mold type of thing, so.
Okay, so it was remediated, it was tested, and it is not anything other than the
Correct.
common mold
Correct.
spores. And here in the high school, we have enough space available to simply relocate those kids
Yes.
while those classrooms are addressed.
Yeah.
And is it limited to just the high school building? Or-
Right now, it's just at the high school.
Okay, and it's not related to any kind of roof leak or window leak that we're aware of?
Exactly, that's exactly it's exactly the point, that we don't have a bulging wall with so much mold in it that it's, that isn't our situation here at all, actually, it's not even close to that. And, it's again, you would see telltale other signs, and when their environmental engineer came in, he's been here twice now, what he did, it was, to the quick version there, he goes into the library and starts crawling on the ground. I can feel some damp, it's falling on the ground, walking, and it's like, feel this, and he has me falling on the ground, so too much is falling on the ground in the library, and he's feeling dampness in the carpet, I can't feel anything. But again, he said, he said, you guys shampoo the carpet? Yep. He says, stop doing that in the summer. He says, because he used to be, before he became an environmental engineer, he used to actually be a maintenance director of a school. He used to be a maintenance director in Needham. And he said, yeah, we all do that in the summer. It's when you have time to do it. And it's the worst thing you could do, because you're adding moisture at a time where ventilation's off and moisture's coming in naturally. He says, you do it February vacation or April vacation. But, okay,
Yes.
we're done shampooing in the summer.
So we're gonna try to meet with them again tomorrow or early next week, just to see if there are some other things related to dehumidification that we can do more proactively, because that certainly would be potentially a capital request if we kind of get.
And again, it's the question is, I'm not trying to be an alarmist with global warming, but again, if this is a product of global warming, we've seen the worst. We've had more rain this summer than we've ever had in our lifetime.
Just making it worse.
My neighbor's sump pump has been going nonstop for, months now, I don't even know.
And that's the thing, is that, this may be the new norm here, and that's what we just have to now adjust and adapt to. It's not something that we did, or we did to the environment, but it's something we did to the schools. It's something that is we just have to respond to.
So
And I believe we're doing that appropriately.
I think April will be good, because February will be hard to get it dry.
Well, we got the heat on those, so the heat, it's that dry air, that's that's something that's in the thing I sent to Nicole tonight, which is, part of me is just, I can't wait to have our first frost and put the heat on, because that at least dry out the air as well, so.
That's the point.
Okay, now we're gonna move on to fall capital. You can keep talking if you want, Mr. Boudet, or is Lisa, do you want Keith to speak, or are you gonna?
We can tag team it. I can just tell you that we met as a budget subcommittee and voted to make one recommendation for $500,000 as a sort of fail-safe in case we need to replace one of the rooftop units at one of the schools. We have, I think it's 18 was the total we counted, Keith, is that right?
Actually, I'm not gonna say I miscounted. I was counting air handling units. The total throughout the district is actually 30 units are on the rooftop, because we do have supplemental heaters in the hallway. that are all acting, they're all working very well. We can get motors for them, et cetera, et cetera. So that hasn't been our problem there. It's the large rooftop units, the air handling units that, again, are the ones that we're starting to have problems with. And it's the two auditoriums, the middle school and the high school auditoriums, which also right air conditioning. The middle school ones in probably worse shape, but it takes less of a load. The high school ones in better shape and is used more. So, where do you go? And the question that we had at Budget Subcommittee is, we've been a district, again, I'll talk about us being good stewards of the town's money. We have not proactively, presumptively, whichever P word you want to use there, replaced units. We wait for them to break and then we replace them because we don't want to, again, spend money before we have to. You start the clock ticking on these units, and these units have a 10 to 15-year lifespan. Where think of the Placentino units that were installed in 1998, we're a little past 15 years there. But we try to make sure that we take care of these units, and we've done that. And do we replace something that's working? And it's taxpayer dollars. I mean, most of us in this room are taxpayers here, and well, two people don't live here, so.
We're all taxpayers.
I can't talk with taxes here. But, the fact is that, again, we don't want to spend money that we don't need to. And so it's that, and Lisa could tell you, or John, it was a discussion we had, and I don't have an answer. I mean, I'll be honest with you, we want to start replacing units, fine. I got 30 units, we'll start throwing $500,000 a year at them and fine.
But I think it's important to note that those provide supplemental heat. So it's not like if one of them goes down, there's no heat in the building.
Right, the classrooms are heated by unit ventilators. And so, that's the heat that comes from the hot water and the boilers. So that's where that heat comes. Those unit ventilators provide both heat and fresh air into the classrooms. So again, that's a different thing. This doesn't affect classrooms. This affects, heat in the hallways, and then obviously ventilation in the hallways and larger spaces. So yeah.
And these have been on the capital.
Oh yeah, like every year.
Forever.
Yeah.
So this isn't something that just popped up out of nowhere. We are aware of these and we have them on our capital plan.
And as you know, they were on our capital plan before the Collins Center had us do that. And because of me putting all those units on the Collins Center report was one of the reasons that, some people weren't necessarily happy with us, but but they're all capital needs, you know what I'm saying? So it's.
They're important because I think you just said that they're also important for ventilation.
Yes, they do, exactly. No, absolutely. And again, it's we're not I'm not trying to slow play this or anything like that. It's just, the frugal side in me doesn't like to replace things that aren't broken. I mean, it's so, and again, we're hoping that they give us the seed money, which is the way I view it, that it's money setting aside for us when there's a problem. If they don't want to do it that way, then maybe we'll change it to that it's money that we will use and start replacing units instead.
And so the FinCom was part of this conversation. They were at the meeting where we voted unanimously to recommend to the full board that this be our ask for a fall town meeting. And they had some questions. We went through all of this, should we be doing things proactively, et cetera, et cetera. And I think Keith did a great job answering their questions. I think that we don't have all the money in the world. So, this isn't something that's going to be catastrophic if it fails. So we get as much useful life out of it. But I think it's the responsible thing to put aside this $500,000, knowing that because we have so many rooftop units that are at the end of their expected life, that we don't want to surprise the town with an ask of $500,000. It seems like the responsible thing to do to say, let's set aside this piece of money because there's a decent chance we might need some of it. So I think that they heard that and were receptive to that argument.
Does anyone else have any other questions? No? Okay, so I would entertain a motion to approve the school committee's request for $500,000 as a capital request for the October town meeting.
Moved by Dawn, seconded by.
Moved by Dawn, seconded by Minnie. Roll call vote, Ms. Koshin?
Yes.
Dr. Savard?
Yes.
Ms. Bigelow,
Yes.
Ms. Naborski,
Yes.
Ms. Gupta,
Yes.
Ms. Rafi,
Yes.
Mrs. Stevick, yes. Great, thank you. Thanks, Lisa. And team, and Keith. Okay, we do not have newsletter.
No, not.
Anything else is different for you? Okay. So warrants. Damn it, warrants. I signed a bunch of warrants. Okay. Actually, I didn't sign this one.
Do you want us to sign them that we're here now, Pete, or do we need to do it?
You guys have voted to be able to take advantage of the.
Yep, but
So-
it's not hurting your wrists at all.
Well, again, I would worry that we would be breaking this, unless we were meeting permanently this way.
Yeah.
It would feel weird.
Okay. So I'm supposed to just say what the following warrants that I signed. I'm sorry.
Correct.
Okay. So I have signed a warrant. It says what it's for.
School bill.
Which is a school bill, okay. A school bill in the amount of $164,454.07. A school bill warrant for $101,320.70. A school bill warrant of $56,377.73. A school bill warrant in the amount of $391,338.93. A school bill warrant in the amount of, a cafeteria revolving account of $10,641.99. This is all the same one. A cafeteria revolving account of $7,159.55. Where's the payroll?
You don't report on that.
Oh, okay. There we go, and those are all the warrants. Okay, items of information in your packet, there was the budget subcommittee meeting minutes from the July 20th, 2021 meeting. Thank you, Lisa, for taking care of those. I'm still awaiting some minutes from policy as well, so we can move those forward into the next meeting. That would be great, which will be October 14th, 2021. We do have executive session this evening, but we will be adjourning. I would entertain a motion to adjourn. I'm sorry, Dawn, go ahead.
Just a quick, October 14th is 5 weeks from now.
That is
I'm
right, yeah.
concerned about other things that may happen. Can we leave open the possibility of something sooner?
Absolutely,
Three
which is,
weeks.
that's what we have set for right
Okay.
now. Yeah. So per our, schedule of, meetings, that's our next scheduled meeting.
Okay.
Doesn't mean that we can't have another
Well,
one.
hold on, so next week is a holiday.
Yeah.
The week after that
We have
is
a
open
workshop.
house,
And then we have a workshop.
and then we have a workshop, so it just,
Can we consider having a short meeting in addition to the workshop?
Sure.
I would imagine there
Sure.
will be additional guidelines, recommendations, possible mandates from DESE. We may encounter additional issues that we need to talk about.
Yeah.
We want to hear back from regarding the impact bargaining and what we just voted on tonight.
Yep.
So I'm a little bit concerned about waiting until October 14th. So that's fine. And if we're going to be here for a workshop anyway.
Yep.
It's possible to have a
Right.
meeting for an hour before
Right,
that.
let's
Yeah, the only thing I
circle
was gonna say,
back.
that's 6 to 8 is what the workshop's scheduled for, so it'd have to be at 5, because I don't think you'd want to.
Right, it'd have to either before or after, right?
Okay.
Okay, but if we want to do it for that date, but let's follow it up and see what happens with our discussions with HFT to see when that happens, so that we can set up a time, and I'm absolutely open to setting up another meeting in between. I know it's a lot of time in between, but I know it's so weird because we were used to meeting like every single day last year and for like the last 18 months, and going back into a like normal rhythm of meeting once a month in the fall, it seems completely foreign. I understand, but that's what we used to do, believe it or not.
I like foreign.
So I am, but I totally understand that, and we'll look at doing that. But in the meantime, our date for right now is October 14th is our next meeting.
Quick question, are
Yes.
they still doing hybrid for the workshop as well as?
The workshop is in person.
There's no hybrid option for that.
I'm not, we can discuss that offline.
Okay, fine.
Okay, so I would entertain a motion to adjourn from open session into executive session for the purposes of collective bargaining with the HFT Secretaries Unit and Teachers Unit, from which we will not return.
Moved by Dawn.
Seconded by Stacy.
Moved by Dawn, seconded by Stacy. Roll call vote, Ms. Koshin,
Yes.
Dr. Savard,
Yes.
Ms. Bigelow,
Yes.
Ms. Nagorsky,
Yes.
Ms. Gupta,
Yes.
Mrs. Rafi,
Yes.
Mrs. Listownik, yes. Thank you, everyone. Have a good night.